Welcome to Healthy Life Keys, the place where seniors like you unlock simple truths for better health. Let me ask you, have you ever trusted a vitamin bottle that proudly claims heart healthy? Most of us have. But what if I told you that some of the most popular vitamin combinations for older adults are quietly increasing your risk of heart disease, stroke, even early death? Sounds impossible, right? But it's happening. One shocking study showed a 70% rise in artery calcification from a so-called healthy combo. Another linked a simple vitamin pair to nearly 50% more heart attacks. This isn't theory, it's reality. And the worst part? These dangerous combinations are often bundled in those fancy multivitamins sold to folks over 60. Today on Healthy Life Keys, I'll reveal the 8 worst vitamin combinations for your heart, ranked from risky to deadly. So hit that like button, subscribe for more senior health tips, and let's uncover the truth together. Your heart depends on it. 8. Vitamin A plus vitamin E. Here's a question. Did you know that 2 of the most common antioxidants, vitamin A and vitamin E, when taken together in high doses, can shift from being protective to harmful? It's true. These fat-soluble vitamins accumulate in your body over time. Studies show that when combined excessively, they promote oxidative stress, leading to artery thickening and increased systolic blood pressure, particularly in adults over 60. A 2013 meta-analysis published in JAMA revealed a 17% higher risk of all-cause mortality, primarily from cardiovascular issues linked to excessive intake of this combination. The deeper problem for older adults is that your body's ability to regulate these fat-soluble vitamins weakens with age. Liver function declines, metabolism slows, and what once seemed like a harmless multivitamin can start building up silently. Imagine thinking you're protecting your eyesight or boosting immunity, but instead, your arteries are hardening. Your blood pressure is creeping up, and you feel more fatigued despite your efforts. Worse yet, many popular anti-aging or immune-boosting formulas stack these vitamins without warning. You might unknowingly double dose by combining a multivitamin with separate vision or skin health supplements, compounding the hidden risk. The early signs: you may notice nagging headaches, lightheadedness, or tightness in your chest, easily dismissed as stress or dehydration. But your cardiovascular system may already be under strain from this vitamin overload. The takeaway: if you're using supplements labeled for vision or immune support that stack these two, rethink your routine. Aim to get vitamin A from food sources like carrots and leafy greens, and keep supplemental doses moderate. For vitamin E, sunflower seeds, almonds, and spinach are excellent sources without the overdose risk. But that's just the beginning. Let's move to combination 7, one that affects your heart's electrical rhythm and may explain those skipped beats or sudden dizziness you've noticed. 7. Vitamin B6 plus B12. Many seniors turn to B-complex vitamins for energy and nerve support. But did you know that combining high doses of B6 and B12 can destabilize your heart's rhythm, especially if you're over 60? These vitamins both regulate homocysteine, an amino acid linked to vascular health. But when imbalanced, they can cause homocysteine levels to swing, stressing your blood vessels. In fact, a 2010 study in stroke found that long-term excessive B6 and B12 intake increased arterial stiffness by 33%, triggering arrhythmias, irregular heartbeats, particularly in older adults with pre-existing heart concerns. The problem becomes even more significant for those already managing diabetes, high blood pressure, or cholesterol. These underlying conditions weaken the cardiovascular system's resilience, making your heart more vulnerable to even minor biochemical imbalances. Even more concerning is how subtle the warning signs can be. Perhaps you've experienced numbness or tingling in your hands, unexplained dizziness, or irregular pulses after taking supplements. Many attribute these to aging, but the truth is your nervous system and heart's electrical pathways may be overwhelmed by excessive B vitamin intake. Another hidden danger? Energy drinks, fortified protein shakes, and nerve health formulas often contain stacked doses of B6 and B12, compounding your exposure without you realizing. If you're experiencing palpitations or fatigue, this combo may be contributing. Get your levels tested before supplementing. Use methylated B12, methylcobalamin, and keep B6 under 10 milligrams daily unless prescribed. Coming up next, a combo heavily marketed for bone health that may quietly damage your arteries and contribute to a hidden epidemic in older adults. 6. Vitamin D3 plus calcium. We've all heard, take calcium and vitamin D to protect your bones. But here's the hidden danger. Without proper balance, this pair may harden your arteries. Vitamin D boosts calcium absorption, but if you lack vitamin K2, the escort that directs calcium into your bones, that excess calcium may settle in your blood vessels. The result? Artery stiffening, increased blood pressure, and higher heart attack risk. The BMJ reports a 30% greater risk of heart attack in older adults supplementing with calcium and vitamin D without K2. The scary part? This process happens silently, sometimes over years. You may feel proud of following your doctor's advice on bone protection, yet over time, symptoms like joint stiffness, leg cramps, or slight chest tightness emerge, early indicators of calcium depositing where it shouldn't. Even more concerning, many seniors unknowingly stack calcium from multiple sources: multivitamins, antacids, bone health supplements, all adding to the overload without realizing it. Studies also reveal that when calcium floods your bloodstream without K2, it doesn't just harden arteries, it can build up in your joints and kidneys, contributing to painful stiffness or kidney stones that reduce quality of life. The solution? Get calcium from food, leafy greens, fortified plant milk, sesame seeds, and sardines with bones, and always pair D3 with K2, MK7 form. Studies show that this combination helps direct calcium safely into your bones and keeps your arteries clear, preserving both heart and skeletal health. Next, we tackle combination 5, a so-called stress reliever duo that can starve your heart of oxygen, leaving you fatigued and breathless. 5. Magnesium plus zinc. Magnesium and zinc support nerves, muscles, and hormones, but when taken together improperly, they disrupt your mineral balance, especially copper, essential for oxygen transport. Excess zinc can deplete copper, leading to anemia and weakened cardiac output. Meanwhile, magnesium alters calcium and potassium absorption, affecting your heartbeat. A 2020 review showed zinc over 40 milligrams daily caused copper deficiency, risking low oxygen levels and weakened heart function. For older adults, this becomes a dangerous cycle. You may take zinc for immunity or testosterone support, magnesium for sleep or cramps, but behind the scenes, your body's delicate mineral orchestra is falling out of tune. Without enough copper, your red blood cells struggle to carry oxygen efficiently, leaving your muscles, brain, and most importantly, your heart, gasping for support. Think about those days when you feel inexplicably winded after minor exertion, or battle with lightheadedness when standing. These are not always signs of aging. They could reflect a silent micronutrient imbalance affecting your blood's oxygen delivery. Even worse, magnesium and zinc often compete for absorption, making deficiencies even harder to detect until fatigue, irregular heartbeat, or breathlessness set in. Protect yourself. Balance your zinc-copper ratio, ideal is 8.1, avoid megadoses, and consider copper-rich foods like nuts, seeds, and dark chocolate to restore equilibrium. Regular lab tests for trace minerals can provide peace of mind. Up next, combination 4, a relax and repair pair that may crash your potassium, triggering arrhythmias and leaving your energy depleted. 4. Vitamin D plus magnesium. While D and magnesium are essential, when combined without monitoring potassium, they disrupt your electrolyte balance, vital for heart stability. Deficiencies in potassium, often silent, can cause muscle weakness, irregular heartbeats, and energy crashes. Seniors on blood pressure meds or diuretics face higher risks. Nephrology dialysis. Transplantation Journal warns that low potassium can raise atrial fibrillation risk by 40%, ventricular arrhythmias by 60%. What makes this combination especially tricky is how subtle the warning signs can be. You might chalk up a restless night, cramping calves, or that faint flutter in your chest to just getting older. But in reality, your heart's electrical system depends heavily on potassium to fire properly. And even mild deficiencies can send those signals haywire. Older adults already face declining kidney efficiency, making mineral regulation more difficult. Adding high-dose supplements without tracking your levels can quietly push your body toward imbalance, despite good intentions. The frightening part? Low potassium doesn't always announce itself with severe symptoms. It often begins with subtle leg cramps, fatigue, or a sense that your heartbeat skips occasionally, a sign your body's electrical system is off balance. Safeguard your heart. Ensure potassium intake from bananas, spinach, coconut water, and avocado, and limit magnesium to 200-300 mg daily. Spread your vitamin D and magnesium doses throughout the day to avoid sudden shifts in mineral absorption. A simple blood test can reveal your true potassium status before hidden imbalances take hold. Now, let's expose Combination 3, a misleading immunity booster that may rust your arteries from the inside, quietly undermining your health. 3. Vitamin C plus iron. Vitamin C enhances iron absorption, but for aging bodies, excess iron becomes a pro-oxidant, damaging your blood vessels. A free radical biology and medicine study linked elevated iron, especially with high vitamin C, to a 47% spike in vascular damage. This is especially concerning because many over-the-counter immunity booster supplements marketed to older adults contain both nutrients together. You may be trying to protect yourself from illness, yet unintentionally increasing the oxidative stress that accelerates artery hardening. Iron, while essential, accumulates with age, particularly in men and postmenopausal women, due to reduced natural losses. When your body can't regulate excess iron efficiently, it acts like rust inside your blood vessels, triggering inflammation and plaque buildup. Imagine thinking you're boosting immunity, yet your arteries slowly corrode, raising your risk of heart attack or stroke. It starts subtly: shortness of breath, rapid heartbeats after meals, or unexpected fatigue. All signs your vascular system is under silent attack. Even more worrying, excessive iron has been linked to higher risks of neurodegenerative conditions like Alzheimer's, making careful monitoring crucial for long-term health. If prescribed iron, take it alone with water, not with vitamin C, unless you have medically diagnosed anemia. And always request ferritin blood tests to monitor iron storage, keeping levels within a safe range. Up next, a heart-healthy combo that can dangerously thin your blood, increasing bleeding risks most seniors never suspect. 2. Vitamin E plus omega-3s. Vitamin E and omega-3s individually support cardiovascular health, but combined, they synergistically thin your blood, heightening bleeding and stroke risk. A blood coagulation and fibrinolysis trial found a 31% longer bleeding time in seniors using both. The problem is that many older adults stack these supplements unintentionally. Perhaps you're taking a fish oil for joint pain, vitamin E for skin health, or both in the name of heart protection. But behind the scenes, your blood's ability to clot is quietly diminishing. As we age, our natural clotting mechanisms slow, and many seniors are already prescribed aspirin, warfarin, or other blood thinners. Layering high-dose omega-3s and vitamin E on top of that can create a dangerous environment where even minor bumps or cuts lead to excessive bleeding. Signs: easy bruising, nosebleeds, or bleeding gums may seem minor, but internally, unchecked bleeding can be life-threatening. Brain bleeds or hidden abdominal hemorrhages are silent killers. Even small warning signs, blood in the stool, headaches that feel different, or unexplained weakness, deserve immediate attention. For safety, get omega-3s from fish, limit supplements to under 1,000 millimoles daily, and avoid high-dose vitamin E. Pay attention to your body's signals: bruises that appear too easily, bleeding that takes longer to stop, or headaches that feel unusual require medical attention. Finally, Combination 1, marketed for bone strength, may be the most dangerous for your heart, yet remains one of the most common mistakes. 1. Calcium plus vitamin D. Marketed endlessly, this pair promises strong bones, but can raise arterial calcification by 70% per BMJ research. Without K2 and magnesium, calcium deposits in arteries, triggering stiff vessels, high blood pressure, and increased heart attack risk. The real danger lies in how gradual and deceptive this process is. You might feel reassured, thinking you're protecting your bones as your doctor recommended, yet over time, the calcium silently redirects itself to places it doesn't belong: your arteries, joints, and kidneys. Over time, the signs emerge slowly: joint stiffness, swelling in the lower limbs, rising blood pressure despite medication, or new onset fatigue when climbing stairs. These could be warnings that excess calcium is silently building up where it shouldn't. Many seniors unknowingly layer calcium from multiple sources: multivitamins, antacids, bone strength drinks, pushing daily intake far beyond safe limits without realizing the hidden impact on heart health. Studies also show that calcium without proper balance can worsen kidney stone formation and contribute to chronic joint pain, creating a frustrating cycle of discomfort and medical complications. Get calcium from food. Cap supplements at 600 milligrams per dose, and always include K2, MK7 form. Leafy greens, sesame seeds, and small fish with bones offer safer, naturally balanced calcium sources. Remember, supplements can support health, but poorly combined, they silently erode your heart. Prioritize nutrient synergy, consult your doctor regularly, and listen to your body's early warning signs before they escalate. And there you have it. Friends, 8 common vitamin combinations that may sound healthy, but quietly put your heart, your circulation, and even your life at risk. We covered how certain pairings, like vitamin A and E, B6 and B12, or calcium and D3, can lead to artery hardening, irregular heartbeats, dangerous blood thinning, and more. All things most seniors never suspect when they simply follow the label. But now, you know better. You've taken the first step to protect your heart, your energy, and your independence. Remember, supplements can support your health, but only when combined wisely. Listen to your body, work with your doctor, and always stay informed. If this video opened your eyes, please do me a favor. Give it a like, share it with someone you care about, and don't forget to subscribe to Healthy Life Keys. Here, we believe that growing older shouldn't mean feeling confused or left in the dark. You deserve clear answers, backed by real science. And that's exactly what you'll find here every week. Thank you so much for watching. Take good care of yourself, and I'll see you in the next video.